Namaste, welcome back to my channel. Today I am going to explain you about cardiology related MCQ for all nursing staff, which will be very helpful for all CCU nurses. So please watch this video till end. The first question is, a nurse is watching the cardiac monitor and notice that the rhythm suddenly changes. There are no P waves, the QRS complexes are wide, and the ventricular rate is regular but over 100. The nurse determines the client is experiencing. Options are premature ventricular contractions, ventricular tachycardia, ventricular fibrillation, sinus tachycardia. The answer is ventricular tachycardia. So patient will be having ventricular tachycardia when there is a absence of P wave and QRS complex are wide. The next question is, what criteria should the nurse use to determine normal sinus rhythm for a client on the cardiac monitor? Select all that apply. The options are A. The RR intervals are relatively consistent. B. One P wave precede each QRS complex. C. 4 to 8 complexes occur in a 6-second strip. D. The ST segment is higher than the PR interval. The correct answer is A and B. So there should not be any irregular RR intervals. So the RR intervals are relatively consistent, and also each QRS complex should follow by P wave. So in that way the nurse can determine it is a sinus rhythm. Next question is, a nurse is watching the cardiac monitor and a client's rhythm suddenly changes. There are no P waves, instead there are wavelines. The QRS complex measures 0.08 second, but they are irregular. With a rate of 120 beats a minute, the nurse interrupts this rhythm as options are A. Sinus tachycardia, B. Atrial fibrillation, C. Ventricular tachycardia, D. Ventricular fibrillation. The correct answer is A. Atrial fibrillation. So in a atrial fibrillation we can see there is an absence of P wave and irregular QRS complex. Next question is, a nurse is assessing an electrocardiogram rhythm strip. The P wave and QRS complex are regular. The PR interval is 0.16 per second and QRS complex measures 0.06 second. The overall heart rate is 64 beats per minute. The nurse assessed the cardiac rhythm as options are A. Normal sinus rhythm, B. Sinus bradycardia, C. Sick sinus syndrome, D. First degree heart block. The correct answer is normal sinus rhythm. Next question is, a nurse note that a client with sinus rhythm has a premature ventricular contraction that falls on the T wave of the preceding beat. The client's rhythm suddenly changes to one with no P waves or definable QRS complexes. Instead, there are coarse wave lines of varying amplitude. The nurse assess this rhythm to be options are A. Ventricular tachycardia, B. Ventricular fibrillation, C. Atrial fibrillation, D. Asystole. Correct answer is B. Ventricular fibrillation. Next question is, a woman with severe mitral stenosis and mitral regurgitation has a pulmonary artery catheter inserted. The physician orders pulmonary artery pressure monitoring, including pulmonary capillary wedge pressure. The purpose of this is to help assess the options are A. degree of coronary artery stenosis. B. Peripheral artery pressure. C. Pressure from fluid within the left ventricular. D. Oxygen and carbon dioxide concentration in the blood. The correct answer is C. Pressure from fluid within left ventricle. Next question is, a client with a bundle branch block is on a cardiac monitor. The nurse should expect to observe sagging ST segments, absence of P wave configurations, inverted T waves following each QRS complex. D. Widening of QRS complex to 0.12 second or greater. The correct answer is D. Widening of QRS complex to 0.12 second or greater. So when there is a in IECG widening of QRS complex more than 0.12 second or greater can consider as a bundle branch block. Next question is, a nurse is caring for a client with unstable ventricular tachycardia. The nurse instructs the client to do which of the following if prescribed during an episode of ventricular tachycardia? The options are A. Breathe deeply, regularly and easily. B. Inhale deeply and cough forcefully every 1 to 3 seconds. C. Lie down flat in bed. D. Remove any metal jewelry. The correct answer is B. Inhale deeply and cough forcefully every 1 to 3 seconds. This will help to reduce a ventricular tachycardia. Next question is, when auscultating the apical pulse of the client who has atrial fibrillation, the nurse would expect to hear a rhythm that is characterized by the options are A. The presence of occasional coupled beats. B. Long pause in an otherwise regular rhythm. C. A continuous and totally unpredictable irregularity. D. Slow but strong and regular beats. The correct answer is C. A continuous and totally unpredictable irregularity. Next question is, the adaptation of a client with complete heart block would most likely includes options are A. Nausea and vertigo. B. Flushing and slurred speech. C. Cephalgia and blurred vision. D. Syncope and slow ventricular rate. The correct answer is D. Syncope and slow ventricular rate. Thank you. Please subscribe my channel and watch all my nursing training videos. Thank you.